Back everybody to the Weiner Wellness Virtual Summit. We are all set for our next lecture with Jaclyn Shedden. She is the owner and operator of Blue Sky Health, and she is also a nurse practitioner that does functional medicine. So I kind of love the East and West that we've been seeing today. Dr. Baker was just on right before you, Jaclyn, and she did such a great presentation on bone health and women, and it was very good. And I'm actually excited to hear this. Testosterone for women is your topic. After baby and beyond. This isn't something that's talked about a lot, but very necessary. So I'm going to step down. I'm going to let you talk, and I'll be here if you need me.
Okay. Thanks, Tracy. And super excited to be with you guys today. Just appreciate everything that you guys are doing at Nutritional Frontiers. You, Tracy, Jamie, Rashid, and Natalie. I absolutely love working with you guys, and you are changing healthcare with your products and your education. So I'm honored to be here with you. So thank you for having me. So my name is Jaclyn Shedden. I am a board certified nurse practitioner, and my practice is here in Tampa, Florida. Go Bolts, go Bucks. And today, obviously, I'm going to be talking about testosterone because it is not talked about enough. And I think there is a lot of confusion when it comes to hormones. And there's even a lot of fear that we have because we are not given the correct information. So testosterone specifically is such a super important hormone for women. And why is that? Well, testosterone is actually produced at a greater amount than estrogen in the body, and it is the most abundant hormone in a woman's body. And most people think it's estrogen, but it is not. It is actually testosterone. And testosterone plays a very huge role in protecting our organs and our systems in the body, and it's going to be your source of vitality, energy, and youth. So it is super important to know what your testosterone levels are throughout your life and have them optimized. Now, testosterone does go down as we age, and by the time we're 40, our testosterone levels are going to be about half of what they were when we were in our 20s. So I just turned 40 in May, and so my levels are optimized. But if you're approaching 40, you definitely want to know what your testosterone levels are because they are going to be a lot lower than they were 2 decades ago. So I'm going to talk about the different benefits of optimizing your testosterone and the different ways to actually do that. So there are a few different ways that you can do hormone replacement, and I'm going to go over those. But first, I want to talk about the benefits because there are such incredible benefits. And I think a lot of times when people think or they hear about testosterone, they think about sex and sex drive. They might think of it as more of a male thing, but sex drive is greatly impacted by a woman's testosterone, and super, super important to know your levels. And I'm going to be talking a lot about that as we go on. But I have been in practice now for almost 9 years, and my entire career as a nurse practitioner, I have been treating hormones. I also am a pellet patient myself. So I have a very unique experience from my own perspective as a patient and then also as a clinician. So I really can understand where women are coming from. And I know the impact that low testosterone levels can have on people, women. So I have a patient that I have been pelleting now for several years. And when she first came into my office, she was in her late 50s and happily married for over 25 years. And her biggest complaints were fatigue, irritability, moody, and basically zero sex drive. So this was a big problem for her in her relationship, in her marriage, because throughout her entire marriage, her sex life was really good. But over the last about 5 years or so, when she first came to me, that was really struggling, and she had no interest in sex. She had zero sex drive or desire, and her husband was starting to feel rejected, and it was really impacting their relationship in a negative way. So she was pretty desperate at this point and wanted to feel better, more like herself, have the sex drive that she was having when she was younger. And so, of course, I was going to check her hormones. I do a complete panel when I have a new patient come in. Thyroid, vitamin D, all of that is super, super important. But When I checked her hormones, her testosterone was actually almost undetectable on the blood work. So that was obviously a red flag. And, we talked about the different options, and she decided to go with testosterone pellet therapy. I said, we'll do the pellet therapy today, and let's chat again. I'll reach out to you in about 2 weeks, and we'll just do a little check-in and see how you're feeling. And then we'll do blood work at 6 weeks and see what your levels are and make sure that everything is okay. So she says, sounds good. She's like, this is my last ditch effort. I feel like my husband is falling out of love with me, and which is so sad. And I really want to have that passion that we had in the past back. I said, okay, so we'll do this today, and then let's reconnect again in a couple weeks. So fast forward 2 weeks later, and I chatted with her on the phone, and she had really amazing results to report back to me. She had more energy in just a very short amount of time. She was actually sleeping a lot better. She was not as irritable, and she actually initiated sex with her husband for the first time in several years. So her husband was super, super excited about this. And so was she. She was just like, it's actually working. I said, I know. I said, well, this is awesome. So let's do your labs in a month, because that will be 6 weeks past, 6 weeks since you had your pellets placed. Make sure your levels are good. And then generally people get pellets, women get pellets every 3 to 4 months. She's like, that sounds great. So I did check her levels at 6 weeks. And when women get pelleted, the levels that we're looking for testosterone are between 150 and 250. And, like I said before, her testosterone was almost undetectable when we first started her pellet therapy. And now it was over 200, just over 200. So that was right within the range that I was looking for. Obviously, the patient is going to tell you how they feel, which is more important than what any lab says. But her labs looked good. She was reporting great results. So I was super, super excited with the results that she was having. And I put her on the schedule for her next pellet, which was about 6 weeks later. So she came into the office for her second round of pellets. And she told me a funny story because a couple days prior, her husband was like, when's your next appointment? Make sure you don't miss it, And and she was like, my husband was more excited for me to come and get my pellets than I was, and make sure that I didn't miss my appointment. And I've seen that a lot over the years. Is the partners are very invested in their spouse's hormone replacement just as much as the patient. And a lot of times I see women first, and then they send their spouse or significant other to me. And because their sex drive is usually a little bit higher than theirs after they've been on the hormones for a little bit. So just a really great success story with somebody that was pretty desperate in the beginning and struggling with testosterone deficiency and wasn't exactly sure why, things were so different for her. But, she's been pelleted now for over 3 years and is just super, super happy with the results. So that is one of the amazing benefits that you can get with hormone replacement, testosterone hormone replacement. And the other topic that I feel is also not talked a lot about, that this is more of a personal story for me, actually, because when I was 37, so I just turned 40. So on July 3rd, 2018, I gave birth to my daughter. And it was an amazing experience. And any parent knows that when you bring in a new baby into the world, it is magical. It is also exhausting. It is the most wonderful experience, but it's also the most tiring experience. And this was no different. I was super excited to be a new mom, but I did not feel like myself at all. Okay, so what I found out later, after I did some investigating, was I didn't feel so good because I was actually suffering with postpartum depression, and I didn't know it at the time. When my daughter was 6 weeks old, so this was like mid-August or so, I went to dinner with my family. It was my dad's birthday, and we were just having dinner, and Sky was obviously with us. She was, taking a nap. I mean, whatever. And it was all of us together, and I was showing pictures of her to everyone at the table. Just, you take like a million pictures when you first have a baby, and I still take a million pictures of her. So I was just showing all these pictures to everyone that was at the table with us. And there was one picture that I showed, and her abdomen looked distended, like some babies' abdomens look like distended. It was totally fine. But for me, that actually triggered this anxiety attack, which I had never had before in my life. So I am sitting at dinner with my family, and I start to bawl. And I'm like, oh my God, is she okay? Blah, blah, blah. But she was actually, literally right next to me. There's nothing wrong with her, but I was having a panic attack so much that I had to go outside, and, everyone was comforting me and stuff like that. But it was a super scary time. And looking back, it was one of the hardest times of my life. And I didn't necessarily understand what was going on. But after a couple of weeks had passed, they said, that's not like me. I know I'm exhausted. I know I'm taking care of this wonderful human, and I'm not exactly sure what to do, but I've seen other women have babies and they're feeling great, So I like to do little case studies on myself, and this was no different. I wanted to check my hormones because before I got pregnant, I wanted to make sure that my body was ready, right, to carry a child. And I checked my thyroid, my vitamin D, my hormones, everything was great. My testosterone level before I got pregnant was 64. My estrogen was like in the 80s, and my progesterone was like 7.5. So all of that was really normal. When I was 7 or 8 months pregnant, I was pretty tired, more tired than you would think you would be at that stage of the pregnancy. I wasn't too far along where I was just exhausted because I wanted to have my child. I was at like the good phase, I thought. So I said, I shouldn't be this tired. So I did check my levels of my hormone levels and my thyroid about 7, 8 months pregnant. And my thyroid was actually low. So I had to go on medication, and that helped with my energy. And, for fun, I wanted to see what my hormone levels were. So my estrogen, 7, 8 months pregnant was 18,000, which we all know that our hormones go up a lot when we're pregnant, but it was 18,000. My testosterone was 120, and my progesterone was 140. So that was cool to be able to see what those levels were. And then it really helped me understand a lot after I checked them, a couple months after I had given birth. And I was having like this severe postpartum depression. So I checked my levels again. My thyroid was pretty good. I was on the medication, but my testosterone had gone down. When I was pregnant, it was 120, and it had gone down all the way to 8. And that was obviously a significant change, especially since it was completely normal before I was pregnant. My progesterone went from 140 when I was pregnant to now 0.1, so basically 0. And my estrogen was 18,000, obviously, like I said, and now it was 25. So I was like, wow, what a significant change in my hormones. And a lot of people don't realize how much anxiety is affected by your hormones, like specifically testosterone levels. So my anxiety was through the roof, and my testosterone was now 8. So it really made a lot of sense, right? So I was like, well, what am I going to do about it? So I was like, I'm 37 years old. I don't necessarily want to start hormone replacement at this time. So I'm going to do some natural things to help, improve my testosterone levels. So once I did have a C-section. So once I was cleared for working out, I went back to CrossFit. I did CrossFit before I got pregnant, and I actually did it all pregnancy, which was really fun. And so I started going back, working out in the gym 3 days a week, bringing Sky with me. And the coaches were so awesome at Cigar City CrossFit because they would hold my daughter so I could do the workouts if she wanted to be held. It was just an incredible experience. I also went dairy free. So I was trying to do all these things naturally because I wasn't necessarily ready to go on hormone replacement. I know my testosterone was really low, but I just wanted to see what I could do naturally to kind of improve my levels. So I did this for about 8 months. Working out consistently, watching Sky grow. And I said, I still don't feel, I was feeling a little better. Obviously I was working out and stuff, but I was having a lot of trouble losing the baby weight that I had gained. And I was still having a ton of anxiety. Sky was sleeping a lot better at this point, but I was waking up all the time, not feeling rested. Anxiety, of course, through the roof still. and I was still suffering, from the postpartum depression symptoms. So I said, okay, let's check my levels again. And I did. And so when I checked my levels again, my testosterone was 13 at this point. So doing all these things for 8 months, my testosterone level had only gone up 5 points. And that's why I wasn't feeling any better. I was 38 at this time, and I was like, okay, I'm going to do some hormone therapy because I don't want to feel like this anymore. And that's what I did. I did testosterone pellet therapy. And within 2 weeks of getting pellet therapy done, I felt like myself again for the first time in over a year, which was a drastic change. And I had energy. I didn't have the anxiety that I was having before, or like that irritability feeling. And I was actually sleeping. And when I woke up, I actually felt super rested, which I was surprised, And that was 2 years ago. And now I'm consistently on, getting the pellets every 3 months, and I feel like myself. And then if I'm a little late on getting them, I kind of go back and feel like that. Just a little bit, I can tell. But it has just been such a huge impact on my life. And I like to share that story because it is such a personal story, and postpartum depression is not discussed. And I know a lot of women are offered antidepressants, and sometimes that's exactly what you need. But a lot of women are not, unfortunately, are not having their hormones checked. And then I have the women that are coming into me, and their kids may be grown, but they say to me that they have not felt like themselves since they had given birth, and it could be 2 decades later, and they still don't feel like themselves. And I usually do find that there is some testosterone deficiency going on. And with the postpartum depression, some trends that I've seen is that women that are having kids a little bit later, maybe like mid 30s, late 30s, early 40s, are the ones that are affected more so. Not to say that you couldn't have postpartum depression in your 20s or whatever, but I see the more significant increase in the postpartum depression when you're giving birth later in your 30s and early 40s. So it's just something to be aware of. It's such a passion of mine for new moms. And even if it's your second child, maybe you're having your second child later, in your late 30s, and you just don't feel the same when the first child you did. I hear that a lot. So, if you are struggling with that, make sure that you're going and seeing someone that understands hormones and have your testosterone levels checked, because that is really the key to feeling better. So some of the other benefits that you might not really think about is bone health. And I know Tracy said that, you guys just learned a little bit about bone health. So testosterone can actually improve your bone strength. So I have a patient of mine who's been pelleted a couple years now. She came into me and was pretty scared because her mom had severe osteoporosis, had a fall, and unfortunately passed away within the last year when she first came in to see me. So she was very, very scared because she had had a bone mineral density scan about a year prior to coming in, and it had showed osteoporosis already in some of her joints and osteopenia. And she did not want to have the same fate as her mom. She was in her 50s. She was very, very athletic and still was having issues with her bone health. So she did do the testosterone pellet therapy and really had some awesome results, was seeing better results in the gym, felt stronger. Obviously the energy and stuff was all getting better too. But she was then, a year after being on the pellets, she wanted, she had an appointment with her primary care, and she had her bone density scan done again. It was 2 years after her previous one. So she came in with the results of her previous one and the new one that she had just gotten done. And remind you, it's a year after she had been on the pellets. So her primary care doctor went over the results with her, and I looked at them, and her osteoporosis that she had in several joints had now reversed to osteopenia, and the osteopenia that she had was actually gone. So her primary care doctor was super ecstatic and was like, whatever it is that you're doing, continue to do it. She didn't unfortunately ask a lot of questions on what she was doing, but she was super happy with the results. But more importantly, the patient was really happy and pretty emotional when she came in and showed me those results, because she didn't know if it was actually going to be possible for her to improve her bone health. I know a lot of women are offered, pharmaceutical grade solutions, and a lot of those aren't going to have the benefits that you're looking for, really none of them, unfortunately. And improving your bone health with pellet therapy, testosterone pellet therapy, is actually proven clinically to improve your bone strength and density by about 8% every single year. So this was just an incredible story, and it was really awesome to see her before results with the bone density, and then being on the therapy for only a year to see the differences that she had. So she was super excited, and obviously is continuing to get the pellets going forward, of course. So what are some of the other benefits that women can gain from doing testosterone replacement? Well, anxiety, like I've talked about a few times, like that is a super huge thing that people deal with. I think a lot of women have a lot of anxiety, and they don't really correlate it with testosterone, because testosterone is often thought of like this rage hormone, road rage or roid rage. And testosterone is actually a really calming hormone for women, and it can be for men too. But it actually will decrease the anxiety, decrease your irritability, and it's not going to like rev you up and make you mad. And so if you're struggling with anxiety and you're not really sure where it's coming from, it could be testosterone. And sleep is also greatly impacted by your testosterone. If you are going into menopause or have menopause or gone through it, and you're having night sweats, okay, so you're waking up in the middle of the night and you're drenched, that is actually testosterone. When you're having the hot flashes during the day, that is from estrogen, but the night sweats are from testosterone. And I have women of all ages, it doesn't have to be going into menopause or in menopause to be having these night sweats, and that is directly related to your testosterone levels. So super important to know your levels, get your testosterone levels checked and make sure that they're okay. And then just energy in general is a huge, huge benefit. We do often have fatigue. We're stressed a lot, from many different things going on. But, super important to just feel like yourself again. And the energy is the most important thing that we have. You want to be feeling like you're ready to go when you wake up in the morning. You've had a full night's rest, but you're still tired all the time. Well, that could be testosterone deficiency. So just something to really, just something to keep in mind. Obviously there's other things like muscle tone and endurance and things that can always obviously be improved by testosterone therapy too. So what are the options if you had your labs checked and you want to do some sort of testosterone replacement? So at my practice here at Blue Sky, I don't do anything synthetic whatsoever. There are different options, which I'm not going to go into, but there are synthetic testosterone options, and the side effects are just not good, and I don't offer that to my patients whatsoever, for men or women. But there are the three different options that I generally offer for my patients are hormone pellet therapy. So you can do estrogen and testosterone. A lot of women just need testosterone, but you obviously can do the estrogen too. And then, so if they don't want to do the pellet therapy, I also do creams and troches, or is like a lozenge. So what are the differences between the two? So all three of those are bioidentical. So what does that actually mean? So your body, obviously makes testosterone, and then the bioidentical form of testosterone is going to be identical structurally to what your own body makes. So there is no issues with side effects like you would have with synthetic forms, because it is structurally the same as your own body would make. And that's why doing the bioidentical form is super important. And the pellet therapy itself for testosterone, for women, it's done every 3 to 4 months. And you come in and you have the procedure. The pellets are actually placed under the skin, like in the buttock hip area. And generally people feel results within 7 to 14 days, sometimes 21 days. And then, we repeat levels at 6 weeks. And you usually need pellets again in 3 to 4 months, depending on the person, your activity level. So that is by far the best option that I know of, because the levels of testosterone are just going to be able to be a lot higher than we can get with the creams and the troches. But I do have some patients that aren't interested in pellets. They just don't want to do it, or, you know, they're kind of new to learning about hormones. And so they just want to do something different first, you know, and they'll do a cream. You know, they have to put the cream on every single day, sometimes twice a day. And, you know, I do get good benefits with that if they're not interested in the pellets. Or for women that do have kids or dogs and stuff, I do usually use the troches or the lozenge that they just put in between their cheek and their gum, and it just dissolves. And then there's no issue with it, you know, coming off on anybody else, like the kids and stuff. So what can you do to optimize your hormones or learn about your hormones and feel better? So the first thing is going to be assessing your symptoms, right? So do you have irritability? Do you have sleep disturbances? Is your sex drive super low or non-existent? Are you having like that anxiety that's kind of come on over the years that you used to not have? You know, those are all signs of testosterone deficiency. And obviously there are other things that can cause those symptoms as well. And that's why I talk about this all the time, is getting the proper lab work done, because that's really important to make sure it's your thyroid and vitamin D and all that is in check as well. But assess your own symptoms, okay? And kind of do an evaluation on yourself, or maybe ask your spouse. They might maybe have a better understanding sometimes of some of those symptoms. And really just see, you know, are you really suffering? And are these something that's kind of gradually came on, or did they come on suddenly after having a baby? Then obviously the next thing is going to be get your levels checked. So you want to do a full hormone panel, estrogen, progesterone, testosterone, FSH. You really want to get the full picture of what's going on. And if you do get your cycles still, you do want to do it in the luteal phase, which is generally the best time is around day 19 or 20. So really important to get your hormones checked at the proper time if you still are menstruating. And making sure that you are actually seeing a provider that is experienced with hormones, because hormones can be kind of confusing, and the ranges for like a normal testosterone level on a lab could be 3 to 60. So if somebody looks at that and you're at a 5, you could be within the normal expected range. But just because you're in the range that the lab has established as, you know, what is expected, does not mean that it's optimized or that you are, you know, not deficient in testosterone. So working with the provider that understands hormones and will really dissect your labs and go over them with you in detail and give you the proper options to feel better. It's super, super important. I can't stress that enough. So the next is do some research, you know, research hormones. And what I do a lot for a lot of my patients is I give them this book. So this is written by Gary Donovitz. Okay. So he is the founder of BioT Medical. So he does all the training all over the country for practitioners for bioidentical hormone pellet therapy. He is an OBGYN. He's pelleted probably over 60,000 people at this point. And this is actually his second book. And I give this out free to my patients, anyone that wants one, and some of them take a bunch and give them out to their friends, because it talks about, obviously the title, Testosterone Matters More, and we don't talk about that enough, you know. So look at some of these peer-reviewed articles. There is a ton of research that has been done on bioidentical hormone replacement, and it is not scary. It is amazing to see the benefits that patients are having from bioidentical hormone replacement. So this is an incredible book that you can get, or if you come in and I will give it to you for free. It is really, really incredible. Okay, the next thing you can also try, I do have on my website, blueskyhealth.com. Sky is with an E, obviously named after my daughter. There is a female health assessment questionnaire that you can take. So it's about, I think, 15 questions, and you can score and see what you get. If your score is over 14 points, most likely you are suffering with some sort of hormone deficiency. I do offer free consults to go over the results with you. And and if you don't want to go over them with me, no problem. You can just go to the website and take the questionnaire and see what it is. Just make sure you're tracking your score. And if you do score over 14, then that's an issue. Okay, so there's a lot of good questions in there that people don't really think about. And it's really, really important, that's a good way to kind of do an assessment on your own. Okay, so just to kind of give you an overview, okay, so you want to do your own assessment and see exactly how you're feeling. When did these symptoms kind of start? Were they gradual? Were they kind of quick, like after you had your baby, or maybe your second baby or your fifth baby? Get your labs checked, partner with a hormone competent provider. So you can go to bioteammedical.com, and they actually have a search engine. So no matter where you live in the country, you can see who is by you, a provider that is by you that has been trained in hormone therapy. And a lot of them will do free consults for you just to kind of get an idea, and we'll do your hormones. And so that is key, is working with somebody that understands what you're doing. Do your research. There's lots of books. If you want to get like this book, I'll show it one more time, by Gary Donovitz. I think it's on Amazon and all that too. But start reading a little bit about the importance of hormones, like all the benefits that I've talked about: bone health, sex drive, energy, sleep, mood. All of those are going to be improved with testosterone pellet therapy. It has to be done right, but people are having amazing results. There's millions of people that are undergoing pellet therapy, hormone replacement. So super, super important just to research a little bit and, educate yourself so that you have a better understanding. For me, when I'm working with patients, I want them to understand exactly why I'm recommending something, going over all their labs in detail so that they fully understand the recommendations that I'm offering. And when you have that knowledge, you're confident in what you're going to do next. And that's such an important part, because there is so much information on Google and beyond that patients come into me and they already kind of know sometimes, most of the time, what they're looking for. And they just are looking for the right person to help them. And I love helping people on their journey, and, just do a little bit of research so that you are aware of the options out there for you. And then, of course, you can always do the health assessment questionnaire on my website and get a better understanding of exactly what is going on. So, Tracy, that is all I have for today.
That was awesome.
Oh, thanks.
Very cool. I didn't know that, testosterone played such an amazing role, and I love learning as much as I love teaching. So thank you so much for being here. We have linked all of the things in the chat for those that are listening. So if you want to get in touch with Jaclyn, if you need an appointment, you do it virtual as well, right?
Yes.
Yeah. All right. Awesome.
Of
course.
Virtual world.
Yeah. All right. You have to. I'm in this box. I'm like the missing Brady Bunch kid. So, well, thank you so much for being here. And thank you, everyone, for joining us. Stay tuned. Our noon conversation is coming up. And Robert Scott Bell and I will be talking about some current health events and things. So that could get a little bit raw. I think Joe Messina is going to join us for that too, which, oh boy, that could get really raw.
I'll be tuning in.
All right, great. Thank you, Jaclyn. So good to see you again. Thank you, everyone, for joining us. Stay tuned, guys, because Robert Scott Bell is up next.